Hi, I'm Jesse Mangan.
I'm Rob Wypond, and this is PsychForce Report TV.
PsychForce Report.
Recently, a new facility opened up in North Carolina, a partnership between ECU Health and Acadia, which is one of the biggest for-profit psychiatric hospital chains in America. And at the opening celebration, there was all the hullabaloo and celebration that you would otherwise expect. But Taylor Knopf, a journalist for North Carolina Health News that does some very good critical investigative work, highlighted an important aspect of this particular case. And I laugh, but I laugh only because I don't know what else to do here. But Acadia has recently had a massive settlement for fraudulently committing people, holding people against their will who did not need to be hospitalized, keeping them longer than they needed to be, and so on and so forth. For $20 million, they settled. And this was at multiple hospitals in multiple states. And so they're a partner in this new facility. And so this article, it's a great little article. I encourage you to read it. Goes into that in some depth and interviews the various people involved. Like, did they not care about this issue? Jesse, do you care about that?
I will say that everyone should pay attention to Taylor Knopf's work. She's doing fantastic work in North Carolina. But I think what this highlights for me is that you have a network like Acadia, who is being investigated by a Senate committee, who reaches a settlement with the Department of Justice related to allegations of fraud. And when we're talking about fraud, some of the specific allegations that they are essentially inappropriately detaining people for involuntary hospitalization and releasing them right up to or right before a court hearing, because a court hearing costs money. So the allegation of fraud is that they are unnecessarily physically detaining people just as long as they can get away with it before judicial oversight. So an organization that has Senate investigations, DOJ, DOJ agreements is still being given the opportunity to build in rural locations, to build more facilities, to take more patients who may or may not also be inappropriately detained. And I think one of the things to highlight here is that there is a real need in rural areas for care. There is a real need for facilities to give respectful, appropriate, timely care that is accessible to the families, that the people that live there. That's a real need. Is this the right organization to be doing that, given all the allegations? Do you really want your limited county municipal resources going to a place that has been repeatedly accused of serious neglect and fraud?
Yeah, exactly. And I want to highlight a quote from the article. I want to get it right here, but Tyler Davis, the CEO of this new facility we're discussing, responded to a question about this history of fraud at the company. And he said, quote, "I've been with Acadia for 11 or 12 years. I've never been part of an organization that did anything questionable or negative." And I appreciate that he may have a more positive view than you or I might, looking at this from the outside. However, it's that what disturbs me the most here is that sort of universal claim that I've never seen a single thing of any kind, even that's questionable. Well, you and I know very well that almost any involuntary commitment, let alone a fraudulent one, any involuntary commitment is fraught with you're doing something against a person's will. They're often afraid and traumatized. There's security involved, threats, intimidation. Sometimes there's full-on physical assaults. People are strapped down, injected. Any number of things could happen in any one commitment, let alone the thousands upon thousands that would have happened while this person was working with that company. And for them to say something so dismissive, so absolutely like, no, essentially almost gaslighting gaslighting the entire country in a sense to say, oh no, nothing to see here, nothing even questionable has ever happened. Like, I just find that so disturbing and so indicative of the challenge we face when we're trying to raise public awareness about these issues.
There's no plausible way that nothing questionable happened during 11 years at a healthcare organization. You could either argue someone is willfully ignorant and trying to maintain plausible deniability, possibly. But the other sort of more reasonable argument I would say is that that's not a good faith response. There's no way a good faith response requires or it allows someone to say, never seen anything questionable. There could be people arguing in good faith that the things that happen, I think the good outweighs the bad. People can attempt that argument in good faith. This, though, there's no reasonable way that that is actually true unless this person is deliberately ignorant of the things happening around them.
Yeah, deliberately ignorant, or I feel, and I don't know, I'm not in a position to know, but it makes me feel as if this is an indication of the kind of problem at Acadia, that people are talking this way and denying any responsibility to take all of those kinds of cases, especially these most extreme ones we've just talked about, and deny anything went wrong at all, which is essentially what the Acadia press release did say, I will add. They were completely dismissive, like, we're just doing our best for our patients at all times. There was really no admission of true liability on their part, even though they did pay the penalty. And again, like, that kind of polarization in this space, which is so needs people to get over it, to bridge that, to be more sensitive to the kinds of difficulties and trauma that may cause someone to end up in a psychiatric hospital, but then also play out in the involuntary commitment process. To me, it's a stunning lack of real sensitivity or even care for what they're supposed to be doing, which is caring and showing sensitivity.
Yeah, definitely.
PsychForce Report, PsychForce Report, PsychForce Report, PsychForce Report, PsychForce Report, PsychForce Report, PsychForce Report. PsychForce Report, PsychForce Report.